Okay, so welcome to this next video in which we are discussing the role of the sarcoplasmic reticulum in pathological cardiac hypertrophy. Okay, right. So, we discussed now how in these concentrically hypertrophied cardiomyocytes, the amount of calcium in the sarcoplasmic reticulum is lower. Okay, so what we now want to investigate is why. Why is it lower? Okay, so we want to now show that the ability of the SERCA2 pump in these concentrically hypertrophied cardiomyocytes to pump calcium into the sarcoplasmic reticulum is reduced, and that accounts for why the calcium level in the sarcoplasmic reticulum lumen is too low. Okay, right, so let's discuss how we're going to do this. So we're going to take some other experimental animal, and I don't know which animal they actually use in this case, and what we're going to do is we're going to basically do something rather mean. We're going to put a band around the aorta, so we're going to induce concentric cardiac hypertrophy in a different way this time to how we did it in the dog, just to add a bit of variety. So what we're going to do is we're basically going to constrict the aorta. So if I draw my little picture of the heart, so I'll draw it here. So here's our picture of the heart. So here's the right atrium, the right ventricle. Okay, and then on this side you have the left ventricle with the left atrium over here, like so. And then the aorta is coming off the left ventricle. So let's just label up these chambers. So this is the right atrium, this is the right ventricle, this is the left ventricle, and this is the left atrium. Right, okay, so what we're going to do is we're going to put a band around the aorta. So we're going to put a constricting band. We're going to hugely constrict the aorta. So we're going to make the lumen of this tube much smaller, basically. So that's going to mean that the left ventricle is going to struggle, because now it's having to pump blood for a much smaller tube. So we constrict the aorta. Okay, and this means that the left ventricle will really struggle to eject the blood out of the aorta, which means that the stress on the wall of the left ventricle is going to go up, and this is going to trigger pathological remodeling, i.e. it's going to trigger concentric hypertrophy in these cardiomyocytes of the left ventricle. So this is another way in which we can induce pathological or maladaptive or concentric hypertrophy in cardiomyocytes of poor old experimental animals. So what we will then do is we'll get the concentrically hypertrophied cardiomyocytes from the heart, and we'll then do our experiment on them. Right, so what we're going to do is we're going to measure the ability of the sarcoplasmic reticulum, the SERCA pump, to uptake calcium. So we're going to measure how good it is at uptaking calcium. Right, so the way we're going to do this is we're going to use a radioactive isotope of calcium, so that if we then expose these concentrically hypertrophied cells to this radioactive isotope of calcium, the calcium should be gradually taken up into the sarcoplasmic reticulum lumen, and we'll look at how good the sarcoplasmic reticulum is at uptaking our radioactive isotope of calcium. So let's discuss the radioactive isotope of calcium we're going to use. So there are many radioactive isotopes of calcium. The most common one that is used is calcium-45. Okay, so let me discuss the structure of normal calcium. So calcium basically has atomic number 20. Atomic number 20. Okay, this means that it has 20 protons, and in the neutral atom it will also have 20 electrons. Now we're talking about the calcium divalent cation, which means it will have lost 2 of those electrons. But the important thing is that it has 20 protons in its nucleus. Now the normal form of calcium, when we talk about calcium usually we're talking about the isotope calcium-40 basically. And calcium-40 has mass number 40. And mass number basically tells you how many nucleons there are. So nucleon is the combined name for protons and neutrons because they both reside in the nucleus. So I'll write that down somewhere. So a nucleon is any particle which resides in the nucleus. So a proton is a nucleon and a neutron is also a nucleon. Okay? So in calcium-40, if the mass number is 40, then that means that the number of protons and neutrons is 40. So we know that 20 of those are protons, so we must therefore have 20 neutrons. In calcium-45, you have a mass number of 45. So you therefore have 25 neutrons and 20 protons. So basically, just to remind you of basic GCSE physics, the atomic number is what determines the type of element you are, basically. Whereas the number of neutrons you have doesn't determine what you are. So the number of protons you have determines what element you are, whereas neutron number can vary, basically, and those give rise to the different isotopes of an element. So we are using this radioactive isotope of calcium, calcium-45, and we're going to basically expose the sarcoplasmic reticulum of our cardiomyocytes. And I should have said that. When we extract the cardiomyocytes from our poor experimental animal's heart, we will extract the sarcoplasmic reticulum from those concentrically hypertrophied cardiomyocytes. We will then expose these sarcoplasmic reticuli to calcium-45 in the external medium. We'll leave them in there for a certain amount of time, and then we'll see how much of the radioactive calcium-45 they've actually uptaken, and we can see how much calcium-45 they've uptaken by because it's a radioactive molecule and will be emitting some form of radiation. I think it is beta radiation, but I'm not totally sure of that. The point is that they will be emitting radiation. Okay, so we can measure the radiation with a Geiger counter, and from that we can determine how good the sarcoplasmic reticulum is at uptaking this calcium. And what you find is that the sarcoplasmic reticulum in these concentrically hypertrophied cardiomyocytes are much poorer at uptaking the calcium-45 from the medium. So in a certain amount of time they will uptake far less than a healthy sarcoplasmic reticulum in a cardiomyocyte would. And that seems to indicate that there is a problem with the SERCA2a pump, i.e. that it's not performing its role as efficiently as it should be. And I'm sorry, I just wrote that where you can't see it. Okay, so overall, to conclude what we've seen in this video, what we have found is that in concentrically hypertrophied cardiomyocytes, the SERCA2a pump is not working as well. This means that the calcium stores within the SR are lower. So every time the heart beats, the amount of calcium that the SR can release into the cytoplasm of the cardiomyocyte is lower. This means that you can recruit a fewer number of fewer sarcomeres within the cardiomyocyte. So loads of the sarcomeres now won't be recruited to contract. So the amount of sarcomeres contracting in these concentrically hypertrophied cardiomyocytes will be lower. Therefore, the amount of force that concentrically hypertrophied cardiomyocyte produces will be lower. And if that's happening in all of the cardiomyocytes in the left ventricle, then the overall force that the left ventricle will produce is lower. So this seems to underlie the pathology that occurs following concentric hypertrophy, which can then lead to heart failure.